I'm going to continue from the previous speakers about going into more details with the association between cannabis and psychosis. Actually, when I previously have been given presentation on this, I have talked about cannabis and schizophrenia. Now, since most studies other than ours have addressed psychotic outcomes, I have tended not to use schizophrenia, but now, as was mentioned, there is some more evidence coming up also in the association between cannabis and schizophrenia. So that might be the main focus of my presentation. And interestingly, I mean, there is a lot of new findings coming up in recent years. When we started, and I was impressed to be actually be part of the history, as was mentioned previously. But now in these days and these years, more and more new evidence is coming up, and this was one example from March this year, and this was the paper by McGrath and collaborators on the association between cannabis use and psychosis. Again, you see, psychosis-related outcome is still the main, the most usual types of outcomes, but here again, I was impressed to see that our early works was giving us the first references here. So this really brings us back to where we started now, more than 25 years ago. And this is to illustrate the fact that the so-called cannabis psychosis is used by tabloid media as something not only well known, but also something that sells. And it's interesting, in contrast to the scientists' caution use about these terms, and rather being advised not to use such a general and unspecific term. Do you hear me well? I feel there's an awful noise in this one, or perhaps I don't know if it's okay. I feel scared by my own voice. Now, as some of you probably know the history, there was some very exciting stories about the French intellectual groups who discovered and tried this on themselves in more than 150 years ago. And as the French physician Moreau de Tours wrote, translated into English as not a single elementary manifestation of mental disorder that cannot be found in the mental changes caused by hashish, from simple manic excitement to frenzy, delirium, from the feeblest impulse to the most irresistible drive, the wildest delirium, the most varied disorders of feelings. And it is true that psychiatrists and scientists have had difficulty in bringing order into all different types of mental health outcomes that can occur as a consequence of or as part of cannabis use. So there are, of course, a lot of attempts to try to bring this into order. Many of you know the ICD system, but this is very general and I would say not very useful to describe mental health consequences of cannabis use. So I still stick to the old classification proposed by the Canadian, Argentinian psychiatrist Negrete, who I just heard is still active. So please send my greetings back to Canada, because I think this is a very useful attempt to classify what can happen as a result of cannabis use. I will not go through all these, but just point out that what has been most common to describe is, of course, the acute psychological disturbances. But there has also since long been evidence of more long-term non-psychotic effects, such as was mentioned by Gabriella, a motivational symptom, and various types of psychosocial disturbances. Now, in what has been called cannabis psychosis, you have different types of syndromes and psychotic disorders. One is the acute brain syndrome, and here I would say it's difficult to disentangle what is an ordinary intoxication from cannabis, because when you do take the cannabis in order to get some altered state of mind, and at which point this goes over to become a toxic psychosis. There is no strong delineation, so you can view this as a rather natural outcome. Then you have the so-called schizophreniform psychosis, and you have a prolonged course of toxic psychosis. But these still require that you have a more or less ongoing abuse. It's more complicated. You also have the withdrawal reaction, but what is more controversial is possible effects of independent psychiatric illness, and that is beyond the episode of current use. And here already, in more than 25 years ago, Negretti pointed out that this is one of the most controversial issues in the discussions of the psychiatric complication of this drug. And I think this is quotations from Lancet a few years ago, and I will come back to actually how major journals now have changed their views on this type of associations that they mentioned here. Now, the reason this has been difficult to disentangle these types of association is that you do have many types of associations, and the difficult thing is to find out what is the hen and what is the egg, which comes first, which is the consequence of one another. And for this you need longitudinal studies, and that is where we have been able to use the Swedish databases to address some of the methodological problems. We have to access the exposure cannabis use, which is not available in public records. There is the assessment of outcome, which is not easy. It has to be diagnosed according to standard criteria. We have to try to find out, is this really cause-effect association? And in that we need to take into account confounding factors. So we were able to find out, actually, this material had not been used for this type of research before, and I got this idea back in the middle of the 80s. That this database was available with all this information, and especially the questionnaires on family background, socioeconomic condition, school performance, and in particular drug use, which is somewhere underneath here, but there was one specific questionnaire made by the so-called military institute at that time, who addressed specific questions on alcohol and on drugs. And then we were able to follow these up in the National Cause of Death Register, in what then was called the National Register of Psychiatric Care, and in particular the Stockholm County Council Inpatient Register. And from these we could select medical records to clarify some of the diagnostic issues. And what we found, some of you obviously have seen this picture, it's now rather old, but it's a very nice, what we call a dose-response association between reported consumption and conscription, and a number of cases with schizophrenia during follow-up. Now, the question we often get is, were they true in these reports? Did they not exaggerate their cannabis use in order not to get into the military service? Now, and I have a few standard responses to this, and one is that if they did lie at conscription, was it associated with a high risk of schizophrenia, the fact of wanting to get rid of the military service? Probably not. So I mean, there is evidence that this type of association, at least it cannot be dismissed by the fact that they were not very truthful in reporting. So we think that there must be some reality on this. And especially when we control for various types of background factors, medication for nervous problem, if they had a psychiatric diagnosis at conscription. Of course, those who did have a psychiatric diagnosis at conscription, they have a higher risk for later schizophrenia, but in this analysis we have control for this, and even taking into account this fact that the remaining effect of cannabis consumption was about a threefold increase in schizophrenia among those with the highest frequency of cannabis use. We did scrutinize medical records to understand more on this association, and this was done for a smaller part of the population, those living in Stockholm County. That's where we are right now. And we did find that cannabis was a dominating drug use. There was no evidence of psychiatric disorders prior to substance abuse, again confirming the causal association, and that the DSM-3 at that time criteria for schizophrenia were fulfilled. There was some clinical differences, a slightly more abrupt onset and more positive symptoms among cannabis users. So there is still an idea that types of schizophrenia and psychosis triggered by cannabis might be different, and this is something we've tried to explore in new research we are now starting. Now, together with British colleagues, we followed this up later in 1996, where we have more cases, 362 cases of schizophrenia. And again, in order to strengthen the causal association, not involving those who already might have symptoms of schizophrenia at conscription. So we excluded these cases and we controlled for additional confounders. So what happened in this more sophisticated analysis? Well, you see, we still have more or less unchanged increased risk of schizophrenia. Now, true, that means not taking into account all the confounding factors, psychosocial background, so forth. But taking into account all confounding factors, we still have this threefold increased risk of schizophrenia. So the results were upheld from our first study. Now, this was published in 2002 together with a number of other papers, for example, the pattern one mentioned by Gabriella, and this was the time, I would say this was a turning point in the scientific and even the public view on the association between cannabis and psychosis and depression as well. Because there was, for example, this study by Arsenal in New Zealand following up on young people in Christchurch, New Zealand, where they found an odds ratio of 4 for cannabis use at age 50. But here the outcome was schizophrenia symptoms, simply because of the fact that they had not numbers enough to assess specific cases of schizophrenia. There was the Fanos study, also in 2002, where they did a longitudinal study of young people, and here the outcome was psychosis. And they concluded that it was particularly cases vulnerable who had an increased risk for psychotic outcomes. Now, in 2004, Arsenal did the first systematic review, and now there were 5 prospective studies, well-defined population-based cohorts controlled for confinement, and our conclusion was that cannabis abuse was associated with around double risk for schizophrenia. And she concluded that the etiological fraction, now the number of cases that could be prevented if there had not been cannabis use, was around 8%. So she concluded that there was neither sufficient nor necessary cause of schizophrenia, which may seem rather natural. I noticed that we're in back of time, so I will try to catch up somewhat. Now, a few years later, there was there were still papers coming up. At this time, there were 7 prospective studies from 6 countries, and again, the conclusion is that there is a double risk for psychosis among high users of cannabis. Now, methodological studies remain, but the conclusion of this review was that there is now sufficient evidence to warn young people that using cannabis could increase the risk of developing psychotic illness later in life. And this was very interesting in the sense that Lancet, which is, I suppose that many of you know that this is considered one of the absolute most influential medical journals in the world. They wrote an editorial where they in fact changed their opinion, and they wrote this. In 1995 we began an Lancet editorial with the since much quoted words, "The smoking of cannabis, even long, is not harmful to health." Research published since 1995, including more systematic review in this issue, leads us now to conclude that cannabis use could increase the risk of psychotic illness. So I think this was an event where perhaps the major medical journal in the world changes opinion in an editorial regarding the health effects of cannabis. Now, there are still unanswered questions. What type of schizophrenia among cannabis users? What is the prognosis? Is it the relapse more or less often? What is the mortality? Because there's an issue of mortality and psychosis. How about cannabis-associated psychosis? This is also an interesting issue. There was a Danish paper a few years ago showing that, this is interesting. Could it be that the case that brief cannabis psychosis, what is often seen as very mild, this person is still active in TV shows and was very publicly known at that time. Could she, by this cannabis psychosis, be an increasing risk of later developing more serious schizophrenic disorder? And in a Danish study, they could show that among patients with cannabis psychosis, later 45% later got schizophrenia. Now we are just in the middle of trying to look at this on our data, so we just have very preliminary findings indicating that of around 100 cases that we had in our series of conscripts with brief psychosis and a history of cannabis, 46% later got schizophrenia. Now this is too good to be true, so this is just preliminary figures. I hope there are no journalists here who would cite this, but this is something we are looking at, and I find this an important topic. So, conclusions. Cannabis may contribute to development of psychosis, including schizophrenia. It's one of the several risk factors. It is not the only risk factor, of course, but it could trigger psychosis in vulnerable individuals in particular. And now the etiological fraction estimated to around 10%. Now you can say that 10% is not much, but most psychiatrists argue that if 10% of schizophrenia worldwide could be prevented by non-use of cannabis, that would be a major advance in mental health. So still, although 10% is little, it's a major. It would be a major achievement if that could be prevented. Thank you.